welcome to Public Health Musings. I'm your host, Dr. Caroline Kingori, a faculty member and researcher at Ohio University. And we are so glad today to be learning and hearing from Dr. Marshall. So tell us a little bit about yourself, Dr. Marshall.
Well, thank you, Dr. Kingori. So I am a native Arkansan. I work here now at the College of Public Health at the University of Arkansas for medical sciences. This happens to be an institution where I got my master's in public health degree. So being able to work here again as a faculty member is a bit of a homecoming, and also, just a really unique and fulfilling opportunity. And I, started my path in public health back in, 2005 or 6, and happened to meet you at Indiana University when we were getting our doctorate degrees. And, I think the work just kind of really took off from there, getting more involved with the LGBTQ community, addressing health disparities, perceived priorities of the community, such as, HIV, as well as bullying and mental health, and just general access to adequate, appropriate, and affirming healthcare. So I've been doing that for a while. It's not fraught with challenges, it is fraught with challenges, especially here in the South and in my state of Arkansas. But each time we are able to, light a little candle, we are starting to see more of the world around us become illuminated. And so in that way, it is rewarding. So.
Awesome. And I recall the first time we met at Indiana University at now the School of Public Health. And, I think it was, I don't know whether it was a stats class. And the first thing you said to me, you're like, I like your coat. And I was so jazzed because I was like, she is so well dressed,
I do like clothes. I get that from my mom.
Exactly. And that's the first thing I noticed. And then, just your smile, your welcoming demeanor. And I was like, yeah, we're going to be friends for a while, for a long time. And it was really exciting to have you as part of my cohort. And here we are.
I know.
So few years
and here
later,
we are,
right?
Both faculty members and man, you are interim department chair or something, which is wow.
No, it's interim associate dean of research.
Whoa, excuse me, even bigger. Whoa.
So exciting. It's just so good to see the progress from our cohorts. And as I was telling you earlier, congratulations on receiving tenure, even after having moved, to a different institution. This process is not easy at all, being a faculty member and having graduated so young with your PhD. So I really commend you on this journey this far. 2 kids later, right?
Thank you. It has been a journey.
Right. So, you talked about being in public health since 2005. And is this something you always wanted to do? Like, how did you get to this point and even decide to go into academia?
Okay, yeah. So public health is not necessarily something I always wanted to do per se. I didn't really know what public health was until I was completing my undergraduate degree at the University of Arkansas at Fayetteville. And I was majoring in biology and broadcast journalism. At the time, I thought I was going to go to medical school, and I thought I'd be the next Dr. Nancy Schneiderman, who was, a medical correspondent on the news. And because I liked to talk to people about health and try to educate folks about ways to take care of themselves and their communities, to, live their best lives. And I just really wanted to do that in some way. I was exploring medical schools, and when looking at this, University, the campus houses not only a college of medicine, but also a college of public health. And I started inquiring about what that was. What do people do there? And that was when I did some research and just fell in love. It just felt like the stars aligned. I was like, that's what I'm meant to do. You can do health education, study, and health behaviors. So that way you can get a better picture of why people do what they do and how it affects their health. And that also, informs the community-based interventions that we do to improve lives. That's how I ended up getting into this field, really.
And I find that is a really common story among us people who are, in public health, just the idea of helping and, trying to enrich our communities and finding ways to improve health outcomes seems to be a theme among people who are in, in social work or public health or in those careers, that are considered sort of helping careers. But when you started with your introduction, you talked about how you have this varied interest, right? You look at health disparities among the LGBTQ community. You have HIV also focused on adolescent sexual health and development. So what really motivated you to look at all those different distinct fields, if you will?
Yeah, they are separate and distinct. To me, they're also interrelated. To me, they all fall under the umbrella of, sexual and reproductive health. But at the same time, because growing up here in conservative Southern states, there was really no sex education. It was abstinence only based education, a lot of fear tactics to scare kids into not having sex. But also, so beyond that, I had several friends because I was always involved in theater, ballet. I had many friends who were members of the LGBTQ community. I had my senior prom date came out to me as gay. And he said, this was before we decided to go to the prom together. Actually, we were just friends, and he shared that with me, but he also followed that quickly with, and you're only one of 3 people that I've told and will tell. And of course I just was like, well, that's cool. Thank you for sharing that. Love you. Let's go to prom. It'll be fun. We talked about that though, to some extent, and I found it a bit unsettling that, someone would be so scared and unable to be their full self with friends, with family. And that sort of opened my eyes to needs that were unmet with youth in particular. So all that said, I thought, coming into public health, we could tackle education, sexuality education, whether it be in schools or communities or whatever, as well as education in our healthcare systems, and hopefully kind of come at some of these issues from different sides. I think, something that we've learned in our public health education coming up is that, you really need a multi-pronged approach to tackle a lot of health disparities. So that's kind of, for me, how that came about.
So just to follow up, how do you feel about sex ed now in Arkansas or in the South?
Yeah, sadly, not much has changed. I feel like we were making, as sex educators, we were making some headway for about the last 5 years-ish, 5 to 10 years. Well, and then with, quite frankly, some of the last, federal administration that was in place, things shifted again, were more restrictive. some of the organizations, state organizations and community organizations that had funding, had that funding removed, or, so some of those efforts have fallen to the wayside. The last presidential administration did fund a lot of sex ed, but they would only fund abstinence only. And so I don't know, I have a lot of mixed feelings about where we are. Most of them are a little bit negative, but I remain optimistic, remain hopeful. I mean, I feel like if I don't remain somewhat optimistic, then, I'll lose the desire to get up and come to work every day. So you have to be optimistic. You have to, keep trying.
And if they called on you for, come over, help us come up with some policies, what are those changes you would want to see? What are those things that would really make you want to get up and go to work?
Okay. Well, that's a good question. I mean, I'm going to go for broke. I want to have comprehensive sex ed instituted K through 12, and in all of our public school systems. I mean, I get that private schools and even some charter schools, you can't, do much. It's up to the administration, school boards there. But, I do know that, these are tools that we know work, that they help students, develop a sense of autonomy over their bodies, a sense of, goal setting, and, that they can achieve things they want in life without setbacks, such as, having to deal with, even if it's minor things like STIs, most of which can be treated. But if it's major things like, how to negotiate sexual encounters so that you aren't assaulted and you can avoid trauma, which can be debilitating, and not to mention, avoiding unintended pregnancies. So, there are tools that we can give our youth that I feel like if people would just get over this idea, this hang up that they have that, oh my God, our kids, are having sex, or the disbelief that they're not, So let's just get that, out of our heads, and let's give our kids tools to protect themselves and, handle, and negotiate potential sexual encounters in a healthy way. I think that we would see a tremendous amount of improvement.
Right. And I'm in support of those thoughts. I teach an HIV and STI course, and the conversation we have, even by the end of the course, it's if we provide this education and the skills needed, then the consequential actions of not providing this information, like unintended pregnancies that lead to other things that are being fought against, would probably not be problematic. And so the idea that teaching sex ed is going to lead to promiscuity is such an old fable tale.
Yeah, it's a myth and it's been debunked time and again.
Right,
I mean,
right.
We've been able to do some amount of research to show, that with comprehensive sex ed, sexual activity declines, but also protected sex, increases, So, and not to mention, if we can include within that, depictions, illustrations, examples of, LGBTQ plus youth, how they, can help in a healthy way navigate their identity development and negotiate relationships that may be somewhat different from, a heteronormative teen dating relationship. I just think that we would see also declines in, suicidal ideation and attempt. And, there are just I just feel like these are tools that are needed and, quite frankly, are called for, from youth. I've done focus groups with both teens and parents in communities, and most folks are on board. They want, this information in their school systems. They want their kids to be equipped on how to protect themselves and have healthy relationships. Youth are all but crying out for help because, we're seeing an increase in assault and in abuse and intimate partner violence. And it's because, what I've heard is that sadly, many youth don't have healthy role models. So they don't know how to navigate the situations in a fruitful way. So instead they lash out, kids are also a bundle of hormones. So, their prefrontal cortex is not fully formed. They're not rationally thinking. So they're just reacting, acting and reacting. And so without tools on how to better cope with, certain situations, it's when we see unfortunate consequences.
Right on. And that idea of comprehensive sex ed is the key. It's not just teaching them this is how you have sex, but it's about healthy relationships. We have this intervention that the Centers for Disease Control and Prevention has developed and has even shown that they're effective interventions towards healthy relationships among youth. We can't close our eyes and assume that they're not doing these things, and they have enough resources.
I know, and you were so right, and the resources exist, and I think that's partly what's maddening sometimes is that we have tools. Just let us, as the experts, implement them. It's like you can't help but think of like the Jerry Maguire, help me help you. You want to help folks, and you have the ability and the capacity to do that, but they have to have the willingness. So it's tough.
It is. It is possible. I work with immigrant and refugee youth who are deep in that cultural, centered way of doing things, which there's nothing wrong with culture. It's just sometimes it can make things difficult when you're having discussions about topics that are considered taboo. We're trying to find ways to empower them so that they can access that information on their own, but it's accurate information. What was interesting in the research that I've done, some of those youth do want to get this sexual health information from their parents. They want to be able to have that conversation with their parents. Sure. They want to have the conversation with their religious leaders. And I found that really impressive, because you would think youth just want to do their own thing and hang out with their own peers, but they do want that relationship and that interaction with adults.
That's right. And I've heard the same thing from my focus groups. It's, they want to have these conversations. They want this information, but because that's not there for them for whatever reason, either, they're going to be too scared to initiate, or, their parents or their religious leaders or whoever are, they're ill-equipped too. They didn't have education growing up either, so they don't really know what to say or how to, navigate those conversations. So because the things are left unsaid, then, kids are act out what they see in TV, movies, social media. That's just the way it is.
Indeed. So again, we can reach out to the parents, we can reach out to the religious leaders and help provide this information. And I know that CDC also has a few interventions, effective interventions targeting such groups. So the work continues, right?
Right. That's right.
Exactly. So, you've done amazing work and you started talking about your focus groups and the findings. What are some of the other interesting findings in your research work and their public health implications?
Okay. Well, so I guess just kind of wrapping up that topic of the focus groups with youth. So not only, did we ask about, sex ed, were you getting any in school? What did it look like? what do you need? What do you know, that kind of thing. And so for sure, teens want, like we talked about, healthy role models. They want to know how to protect themselves and navigate their relationships. They, want to know how to handle heartbreak. They want to know how to help their LGBTQ friends. They want to know how to be affirming. They want to know how to stop bullying when they see it. They want to finish school. They want to know how they can, have kids. And they want to know how to do that beyond not doing it. They want to know what all of the contraceptive methods are, and what their risks are, what their benefits are, and they want to be able to make informed decisions for so that they can not only protect their bodies, but develop healthily and pursue their dreams. We also have talked to a lot of transgender, gender nonconforming folks around the state of Arkansas and in other states in the South. And so from those surveys, interviews, community engagement conversations, we've learned, that healthcare experiences are not always healthy experiences. Sometimes seeking care when things have, not gone well, whether it's, in unhealthy relationships or, so whether they need STI care or, they're seeking birth control, pills or contraception, what they might have been playing volleyball and broken an arm, whatever the situation is, they're seeking care, and they're often met with, unfortunately, stigma, and sometimes trauma and abuse. So that then gets, that exacerbates whatever situation that they're in. Unfortunately, folks then take a long time to try to return to a healthcare setting, which can, have deleterious effects on their health, or just prolong initiating treatment for something. Anyway, there's a lot that we need to do in terms of education, whether it's in our schools, in our communities, in our healthcare systems. We're working to address some of that here on our campus and beyond with doing a lot of interprofessional education for students by having gender affirming care lessons. We're having simulated interactions with trans and non-binary patients for our up-and-coming medical and nursing students. We're also hosting some different panel conversations of community members who can share, what their real lived experiences have been in trying to seek care, and what they would hope healthcare providers would do differently. We have initiatives that are being rolled out with, pronoun stickers and for patients when they come in. Also, our healthcare providers have an extended name badge with their pronouns on the bottom. We're, trying to promote more literature and posters to, showcase like this is all are welcome. We're trying to be a welcoming place, an inclusive place for healthcare. We're also, systematically trying to address not just the education for up and coming healthcare providers, but also current providers on how they can be more affirming and change some of their practices and protocols to better assist folks. And just showing that it's not about, identifying as trans always. It's if you have a more welcoming, inclusive environment, that's better for every patient. That's just patient-centered care. And so we're trying to do a lot of that too.
Awesome. That sounds like really great and innovative work. So as you expand or as you continue with your research trajectory, do you see yourself picking up any new topics or expanding in different ways?
Well, sure. I think so, because I started out with my dissertation interviewing youth, LGBTQ youth who are bullied. And that has sort of evolved into what I'm doing now, which is, focusing more specifically on trans and gender nonconforming folks and any traumatic experiences they have and trying to access healthcare and how to better provide care for them. But through some of my early work in HIV, that sort of evolved now into collaborating with one of my esteemed colleagues who does a lot in the criminal justice system. And so getting PrEP linked up to folks as they're released from, the county jail. There is also some work that's happening in our, state prison systems that I have not been as directly tied to, but we have talked about doing some grant projects there too. So I definitely never saw myself doing anything in a jail setting, but there you go.
And I think the incarcerated community, we have not done enough where HIV prevention is concerned. We don't allow condoms in prison, and there's PrEP, there's some HIV medication, but that's not enough if you're trying to change people's behavior. And so more often than not, they settle convert while they're still in jail, and then when they're released, it's always they find this broken system, and trying to track them can sometimes be really challenging. So I commend you as you think about moving, or expanding your research to include that population. There's a lot of need with that population. So as we wind down here, there are a lot of people now that, with COVID, public health was put in the limelight for good and bad reasons, with all the different changes that happened. Wear your masks, don't wear your masks, all these things. Knowing that we were dealing with a health issue that's a moving target, so you're learning as you go. What advice do you have for people interested in public health?
Oh, just get involved. I mean, there are just so many paths that you can go in public health, and every individual's journey will be different no matter what path you choose. Mine has certainly evolved, as just mentioned, but it's all worthwhile. I think that anything you can do to get involved in public health, whether it's volunteering at a COVID testing site, or finding out how you can be a community health educator. There are just so many things that you can do, paid and unpaid. And we need help. That I think that's one of the sad parts of the pandemic, was the, revelation to a lot of folks of how broken our public health infrastructure is. And so if we can, get more boots on the ground, so to speak, to, get out there and improve the health of individuals, families, communities, I think the better off we will be.
And adding on to that, people are often willing to help, but we know from the community participatory research that we do, we have to be very conscious and deliberate about how we approach communities. What advice would you give from your experiences?
Yeah, well, I guess so based on what I'm hearing you say, so to getting involved in particular communities, yes, you really have to have that buy-in. If you're not a member of that community, I don't necessarily identify as LGBT or Q, but I have friends, family members that are. I am connected to different community-based organizations that are LGBTQ led, and have, their buy-in, their support, their participation in any initiatives that, we're trying to deliver, and, because really it's not about what I'm doing, it's what about those folks are doing, and I'm just facilitating or aiding in some way. Because grants do flow in through academic institutions more often than not, at least the big dollars, so, we got to have those partnerships, and, any of the projects that I've been leading, it's really me co-leading and partnership with different folks who are living out the issues we're trying to address. So yeah, you got to have that partnership.
Indeed, partnership and empathy, right?
Oh, sure, yeah.
Yeah. So, what are your most memorable moments in your work or life to date?
Wow. So work or well, I'm going to say work life. So in my work life to date, there's a couple of student interactions that have really stood out. There had a undergraduate student several summers back who was working on a project with me, and prior to her doing that, she was very focused on going into, I think, psychology or something like that. And, after that summer, she said, it's because of this, I want to go in public health now, and I was like, yes, score one for the team, but it's also, she learned how psychology plays in to, helping us understand folks so we can better, meet their needs and get them to choose healthy behaviors and things like that. But, also I think she saw how broad it is, but also, so you can almost make it whatever you want it to be. And you can carve out, your niche. And I also have another student who I have just been, when I get teary-eyed, like just so proud of, as she has finished her doctorate under my mentorship in this program, and she's doing a postdoc now, and she's just doing all kinds of funded research that is just so good, and publishing all these papers and just really changing the world. And I'm just so moved and that I could be a part of her journey, and and put her out there to do the work that she's doing. So for sure there are those moments that I really have appreciated having.
Oh, I hear you. It's always nice when we see the students just flourishing, and
it's a beautiful thing. It really is.
Yeah. And then mentoring them. I have a few of those, and it's a proud moment.
Yeah, I mean, I'm proud of my own babies, but I'm also very proud of my student babies. So
I call them the academic babies, and see them like starting to crawl when the research experience is concerned, right. And then they walk. Yeah. And they're doing all this amazing and, presenting at conferences, and just the interpretation of the research and the ability to articulate that. You're like, oh my God.
And, and they're so smart, and sometimes they don't even know how smart they are sometimes. Heck, much smarter than me. So I'm just so glad I could, give her anything, advice to just keep going. That's basically what mentorship is half the time, is just saying, you're doing great, keep it up.
And I learned so much from them, or, sometimes you even see yourself from those days, which even helps with increasing that empathy towards their needs and what the challenges that they're facing as grad students. I mean, you remember those days, right?
Oh gosh, yes.
So some
I think I've blocked out many of those days too as a grad student. But
there were some rough days, and so when I can, I want to make this experience a little better for them. And I appreciate when they're, like smarter than me. That's how it's supposed to be. The student should be better than the teacher as they continue growing, and we never stop learning. And I learn from them every single day. So I'm with you on that, with those memorable moments. Just so amazing to see them grow and just become this incredible human beings making a difference in the world, right?
It is. There's nothing like it. That's for sure.
So I want to say thank you so much for speaking with me despite your busy schedule and just carving this time out to share your experiences and your research. And if people want to get in touch with you, how do they do that?
Oh, sure. There's a couple of ways. I don't know if people still do the Twitter, but, I'm on there. A Marshall Tweets. You can email me at smarshall@uams.edu. Just Google Alexander Marshall, Arkansas. I'm sure I'll come up. There is more than one Alexander Marshall. I acknowledge that. But I don't think there's more than one, in Arkansas, and for sure not here in Little Rock. So awesome. So thank you so much, and thanks to everyone who tuned in. And I hope to just follow up with you and continue to see the great and amazing work that you're doing. So many years later, we are seeing each other. Likewise. I mean, I just I always hold you in such high regard, and so I look forward to see you just continue doing what you're doing. You're doing great things.
Here, I hold you in high regard too, and I'm so glad we got to connect again and just reminisce on where we've been and where we are and where we're going, isn't it?
That's great.
Awesome. So thank you again, and talk to you soon.
Okay.